Okay.
Well, thank you for being here today. My name is Olivia Deschenes, and I'm a part of the Lewiston Youth Advisory Council. And what's your name?
My name is Hamda Ahmed. I'm the program manager for New Maine Public Health Initiative. And thank you for having me.
Yeah, you're welcome. And can you describe a little bit about what this organization is and what it entails?
So, New Maine Public Health Initiative were created in 2014, 15, and they help essentially people living in Lewiston urban area, especially the refugees and immigrant population. We have different programs. One of them work with children who have special needs. We have behavioral health professionals. We have target case manager that support those families that need to be connected with the resources that exist and their special needs kids' needs. And we have other programs such as the health literacy that is about teaching the new immigrant, new Mainers to women health, men health, adolescent health. And now we have another program that is community health workers, especially designed to assist the community impacted by the COVID-19 to connect to the right resources.
Yeah, I think that's amazing. I really respect what you guys are doing. I'd never heard of your organization. And when I started to research it, I thought what you guys were doing was amazing. And I really appreciate what you're doing. And what does your job as the manager entail?
So, before that, I just started the work in last February, and right after, as a target teams manager, and right after that, we had the COVID, and our office has to close. I was working as a program coordinator at home, so trying to help facilitate the communication with other organizations and other funders or any work related to my job. And we created at that time during COVID a coalition called LA Task Force. LA Task Force is like different organization of new Mainers that came together to respond to the needs of our community. And right after that, I got replaced by the program manager that existed, and it was kind of new work for me.
Right.
And my job is just providing all that different project that we have.
Yeah, that's a big job. And I know you touched on it a little bit, but what other adjustments have you and your team had to make during COVID-19 to accommodate for everyone and everything?
So one of the things was advocating for the immigrant and refugee that live in this area, especially in Lewiston and urban area, so that they got connected to the right resources. And one of the things that we did was advocating so that they have a testing, because
Exactly.
most of them live in a high risk area. We see people like with a large family entering from the same door, and you know how Knox Street, Bridge
Exactly.
Street, all that area is
Yes.
packed, and if one person get hit by COVID,
Everyone does.
Exactly. So we had a huge impact during the in June, July that time, while it was a month that most of them were like fasting and were at home, and they also had a community transmission. So that was a very big impact, and at that time we just advocate so that those people have testing. So far we did 2 tests to mobilize the community and ask B Street that those people have a walk-in for a test.
Yeah.
So to regulate and see who is impacted and who is not. So far, we are doing okay with all the CSW that we connected with them.
That is great. And I know that COVID-19 definitely disproportionately affects immigrants and refugees. And how have you seen that, and what has to change in order to make that better?
So, since we all see on the news how COVID impacted mostly people of color, and because of money reason, it could be from their nutrition, it could be about most of the people who live in Lewiston are mostly low-income family. All of that had an extra impact on how it impacted them, and we just try our best to respond. It was not easy as a community leaders to regulate that, but we did our best to advocate, talk directly with the CDC, and participate to different Zoom call so that immigrant and refugees that live in here have access to different resources.
Yeah, and your actions definitely have not gone unnoticed. That's why you're here today, because the Lewiston Youth Advisory Council reached out, and we saw that you guys had made a huge impact on immigrants and refugees, and that is very important, especially considering how much diversity we have in Lewiston. And yeah, in what ways do you think the public could help your institution? And is there any volunteering opportunities or anything that they can do to help you guys get the resources you need?
Yes. It's always I always I always ask, I always recruit
Right.
money people, so that and I always say that your work is always important in a way to another, because that we have kids that were turned to remote schooling, and many of the parents don't know how to use those technology, and when children are studying from home, it was not something that we're working for immigrant and refugees.
Yeah, that's true. I didn't think about that.
Yes, it was really hard. So those kind of support to the families will be really good, so that they don't have another impact from the homeschool, from the remote schooling, and have a kind of delay on their studies.
Yes, exactly.
Yeah.
And if you could change something that happened, or if you had to relive it, was there anything that you would do differently?
As a
Yeah,
as
just
an organization, or
yeah, as an organization or yourself individually.
Something that I will do differently.
We can definitely move on to,
Yeah.
because it sounds like you guys did more than enough and we're completely qualified. What's a major lesson that you learned during COVID-19 and that you would, assert in your future?
Something that I learned is the more that you get involved and you do the work patient and you do the work without thinking of am I getting paid or not, without like categorizing like the people that you are like helping. COVID like impacted everyone, black and white, like every American. So the fact that you are seeing everyone like what they are dealing with and responding to their need as soon as possible without any delay.
Yes. And has anything gone well, or have you seen any silver linings during this time that you would like to talk about? Something good that happened that surprised you, or something like that that happened?
Yes, something good that happened was that health providers like B Street like reduce the barriers that people were taking people were having to get to have a test.
Yes.
There has been a lot of barriers for the new immigrants. People were not able to connect directly to request.
Yeah, they didn't have the resources they needed.
Exactly, to request that test, but now they remove all that barriers, and now it's like much easier to be tested than when the COVID started,
Right.
and when we were having the community transmission. Now they are more ready in case of a second wave or something. I wish that, I really hope that this will continue.
Yeah, it's really great to hear something good that happened. More accessibility is always great,
Yeah.
and I think during these times, those silver linings are definitely something to hold on to.
Mm-hmm.
And how do you think that your work has positively impacted immigrants, refugee youth, and families in Lewiston?
So most of the families that live in here as refugee or immigrant or asylum seekers are very large family. Sometimes there is just the head of the household that that is the only person that works for that family. So having that language barriers, having that maybe one or two people, the household that work for the family, the transportation issue. So all those barriers impacted like very hardly to the family of refugee and immigrant.
Right. And do you have anyone that you would like to recognize for their hard work during COVID-19?
I would like to recognize all the members of the LA Emergency Task Force that started the work, a union, a kind of solidarity with the community that they were helping always. And this show like that there is people in this community that we can continue to trust them and can always like find solution to the problem that exists.
Yeah, I think that unity is really important right now, and I think that's amazing that you found it during these times. It's really crazy to think that something so hard there could be a silver lining to that, and that, you know, something good could come out of it, and we could have solidarity.
Exactly.
And be one,
Yeah.
especially in Lewiston. I really love that.
Yeah.
I'm proud of us.
Thank you.
Well, thank you so much for being here today. I know it was really last minute,
Yeah.
and you didn't really know what you were getting into,
Yeah,
but you did amazing.
Thank you for having me.
Thank you.
Yeah, thank you.